at the University of Maine, what we're trying to do is develop technology that helps us find missing people, lost people. And in the course of that, when you find a person, you realize that all of a sudden you can do something for them. So it became obvious that upon finding someone, what could we do to intervene to help the patients? In conjunction with the students here, we've been looking at ways of assessing a patient in order to find out what's wrong with them, so we can then intervene better with the drones and the UAVs that we have, and with working with DME and rural EMS at the university. It allows us to bring in gear and equipment based on what we find. So the focus at the university in the last 6 months or so with the students has been to try to develop technology that assesses a patient's vital signs from a UAV at far field, which is away from them a bit, or near field, which is close to them, but all non-invasively. And we try hard to do is support the medics in the job they're trying to do, and that is get the patient out sooner than later and get them out treated and safe and under less misery. And then allows the doctors down the line in Eastern Maine, when the receiving place we take the patient, to prepare for this patient. So what engineering's focused on is they're trying, and biomedical engineering especially, is what's the problem, and they develop their own solution to that problem as their senior capstone. They apply different parameters and limitations and the true logistics of what you're trying to do, whether it needs to be lightweight or not to fly on a drone. Then they bring that in as a senior project and build that so it'll assist us, and then try to get that prototype out there to really help the patient. And say that you had a patient that was down, okay, fallen on a trail somewhere, fallen on a cliff. The drone goes up searching for them. Say the weather's bad and we can't get in helicopters and fixed wings, but the drone can get in because it has a window of space that can get into. It then finds this patient, okay? Then it turns from a finding mission to an assessment mission. So then the drone starts doing the what's wrong with the patient, what can we tell about the patient, the clues that we get from that. We then at the EMS side and the ambulance side can start flying in equipment to help intervene. So it becomes not only a finding tool, but an assessment tool, and now you have an interventional tool. Well, something as simple as in chest pain, on a mountainside, for instance, you're having chest pain, you could fly in aspirin. Hypothermia, you could fly in a thermal blanket, rewarming packs. If the medics were up on the trailhead with the patient, in theory we could use hydration for the patient flying in. But also, once we get in there and if there's further assessment or further things found, in that time they're coming back out, we can still fly in antibiotics, say. Okay, there's things the medics can then do, even though they're with the patient now, but they can't get back to the ambulance to get that equipment, or they can't get back to the hospital. There's a whole list of missions that we are coming up with that we think we can make a difference in. So whether it be hydration, hypothermia, comfort, a cell phone. You could fly a cell phone and make the person call their loved one, and that can make all the difference in the world.